In this video, we will train you on the proper use of the HoverSling Repositioning Sheet to prone patients in the operating room. We'll explain how to prepare the equipment and the patient for proning, the technique for proning the patient, and how to turn the patient back onto the stretcher in a supine position. This technique is recommended for a patient with a stable spine. Position the stretcher next to the OR table with the stretcher rail down closest to the OR table. Ensure the repositioning sheet is untucked between two surfaces. Lock the stretcher wheels. Raise the height of the stretcher 2 to 3 inches above the height of the OR table. Assess the patient to determine if they need to be moved closer to the bed. If the patient needs to be moved closer to the bed, attach the air supply by inserting the hose into one of the intake valves and secure. Inflate the HoverSling Repositioning Sheet by initiating airflow using the 39-inch HoverMat button and slide the patient to the edge of the stretcher closest to the OR table. Press the standby button to stop the airflow. Disconnect the hose. Secure the patient's arm that is the closest to the OR table. In this video, we are using a pillowcase to tuck the patient's arm. Ensure the arm is in an anatomical position with the thumb up per ARN recommendations. Check to be sure all tubes and lines are clear of patient contact to prevent kinking or disconnecting during and after the turn. Employ headrest pillow as per the manufacturer's recommendation prior to turning the patient. Tuck 4 inches of the HoverSling Repositioning Sheet under the patient closest to the OR table. Attach the blue shoulder and hip sling straps to the hanger bar on the turning side. Confirm team members and patient are safety before starting the positioning. Raise lift with the blue shoulder and hip straps attached. The patient will slowly start to turn as the hanger bar is raised. Caregivers should guide the patient onto the OR table by following best practices. Adjust patient as necessary using appropriate positioning devices. After surgery, bring the stretcher alongside the OR table with the HoverSling Repositioning Sheet on the stretcher. Ensure that the wheels of the table and stretcher are locked. Raise the height of the OR table to 2 to 3 inches higher than the stretcher. Secure the patient's arms closest to the stretcher. In this video, we are using a pillowcase to tuck the patient's arm. Ensure the arm is in an anatomical position with pinky up per ARN recommendations. In this video, we are using a HoverMat single patient use link on the OR table to turn the patient back from prone to supine position. Tuck 4 inches of the HoverMat SPU link under the patient closest to the stretcher. Attach the air supply to the HoverMat SPU link. Confirm team members and patient are safe before starting the positioning. Then initiate airflow by pressing the appropriate button for the size of the HoverMat SPU link. The caregiver closest to the patient will gently apply upward traction on the HoverMat SPU link. This will facilitate the turning of the patient. With larger patients, this caregiver may need to gently push to keep the momentum. As the patient begins to roll on their side at the edge of the OR table, the caregivers on the receiving side are positioned with their bodies up against the stretcher. Caregivers' hands are raised to receive the patient's body, supporting the shoulder and hip. Caregivers should guide the patient onto the stretcher and raise the side rails. Please refer to the HoverSling Repositioning Sheet and HoverMat Single Patient Use Link product manuals for detailed instructions for use.